A very good evening and welcome to the India Development Debate. I'm Tamanna Inamdar. Is rural India and the surge of COVID cases in rural India becoming the next massive challenge that we face in fighting the coronavirus global pandemic? That's the big story that we're discussing this evening on the India Development Debate, but we have a lot more lined up for you. Let me just tell you what's on the show before we move ahead. So we're also going to talk about the EIA 2020. That's the Environmental Impact Assessment Draft Notification 2020. What is it? Why is it important? Why has it become so controversial? A deep dive coming up on the show. Suffice to say, it is something that will form the basis on how companies are assessed for the impact they have on the environment. Experts and environmentalists, among others, are up in arms because they fear the rules are being diluted way too much. In the big voice of the day, today you will hear from Pawan Goenka talking about the India Revival Mission and how he believes the economy can be brought back on track. And it is a virtual workshop experience that I would like to share with you. Since we can't go out anymore, in a lot of cases, the next best thing to fine dining is to meet the chef. So I have attended this virtual workshop with the chef at the Bombay Canteen, Chef Thomas. My review and experience coming up ahead on the show. But let's begin with the big story. Now, till a few weeks ago, I would say till about a month or so, the concern was the hotspots emerging in India's large cities. Mumbai, Delhi, Chennai, Bengaluru. We saw localized lockdowns coming into place because of it. The concerns were that very densely populated areas and a huge number of cases would create big issues in these hotspots. The narrative has changed to some extent in the last few days or so. And now the big issue is a surge in cases in rural and semi-urban areas. In fact, data suggests that nearly half of all new cases are being registered in rural and semi-urban areas. Now, these come with their own set of complications. Some of those complications include a lack of adequate medical infrastructure, even lesser than that in the city. Now, compound this with the fact that rural India is also driving right now India's recovery. Your demand is improving there, the narrative is that incomes are improving there, and then you have the surge of COVID cases. Will this derail our recovery plans, and how can we deal with the surge in rural India? To speak to me about this today is Siraj Hussain, former Agricultural Secretary. I'm also speaking with Dr. Shashank Joshi, top doctor in Mumbai and also part of the Maharashtra State Task Force on COVID-19. I'm also pleased to welcome on the show Mayank Shah, category head at Parle Products. Welcome to all of you and thank you for joining us this evening. Let me begin by getting a take from you, Dr. Joshi, on what has been the experience in terms of rise in cases in rural India. Let me talk about rural Maharashtra, where we have seen a rise in cases. Does this pose a very particular challenge to governments and policymakers?
So there is a surge in cases in rural Maharashtra, rural India, but even if the number of cases are going up quite rapidly, it is not that big a concern because there are not many densely populated conglomerates like cities, and it's easier to contain and micro contain in rural India. So from a public health standpoint, the only challenge is access to care, but from public health standpoint as a containment strategy, it is still the same old yardstick, which is aggressive testing, the tracing and the isolation. Now the tracing is much easier in rural and sparsely populated areas, and therefore from a public health perspective that is not a challenge. But once the diagnosis is made, to get access to care, sometimes particularly for that 5% of 15% of cases which might have moderate to severe COVID, there could be a little bit of a challenge where if an efficient emergency ambulance service is in place so that the patients can be shifted to the right infrastructure, then to a large extent the problem can be mitigated. But rural India will need a different strategy, and it will be a strategy of micro containment in a more aggressive way. And if appropriate micro containment is done in aggressive way, I think we should not see this as the urban ghettos across India showed a challenge. I think this will be much more easier to handle and mitigate.
All right, that's optimistic. But what is concerning is the rise in the percentage of fatalities, and that is the one number that is most crucial to watch out for when talking about COVID-19. Here, the share of urban areas, the fresh daily deaths, is falling. Meanwhile, in semi-urban areas, it's growing from 10 to 18%. In rural areas, it's nearly from 6 to 12%, nearly doubling. So the fatality rate will also become a concern. Siraj Hussain, do you share Dr. Joshi's confidence that it should not be such a big issue because these areas are sparsely populated? Does the lack of adequate healthcare and infrastructure remain a big glaring problem?
I'm not competent enough to speak on this subject, but I can only say that the migrants who had gone back to their villages are very keen to come back to their places of work to find employment, because now that the cropping season, the sowing season is over, their earnings would have gone down. So whatever feedback I'm getting from UP and Bihar is that people want to come back. But even in the cities, COVID has not been really contained entirely. So if that can happen quickly, if urban areas can contain COVID-19 quickly, these people will come back and then the economic activities will start much faster.
Mayank Shah, I want to shift the focus a little bit to demand, and we've been talking about how rural India is driving demand. Do you see that as a sustainable trend? Do you see that as really continuing even in the face of increasing number of cases?
Yes. And the reason is I completely agree with Mr. Shashank Joshi that rural India is very different. If we are looking at a setup in rural India, it's very different than urban India, which is densely populated, or metros which are densely populated. So population density there is lower. So probably the challenge of containing COVID there is very different, and to my mind not probably as challenging as it would be in a metro. That's one. Secondly, given that, and based on what all observations that Mr. Joshi shared, I would say that one can go out and do purchases, or demand would relatively be intact, because if at all you have to have or impose some kind of lockdown, probably the strictness of that lockdown may not be as severe as that of the micro lockdowns or the intermittent lockdowns that we saw in metros, and that's primarily because of the population density, as I said. We have seen that severity of the cases as a percentage of the total who are infected is much lower. So as Dr. Joshi said, I think the focus should be primarily on providing them some kind of care or infrastructure to ensure that they get some kind of medical facility available to them, so that they can get cured. But otherwise, if you ask me, I think naturally, by the virtue of lower density and sparse population density, I think they are well placed or better placed compared to their metro counterparts in terms of containing the entire thing. And hence, probably the challenge also may not be as severe as what it was for government authorities to contain COVID in urban India. So given that, what I feel is that because the severeness of lockdown may not be as much as that of what we saw in urban or metros, the demand relatively would remain intact and may not really suffer. Also, the units are smaller. So let's try and understand another thing. A village unit or a rural unit is much smaller than that of an urban unit or a metro unit, where probably because of the dense population, maybe, the contribution of a big metro or even an area of a metro may be high to your business, which is not the case with, one unit of rural, which might be the village. So let's say, even if you have to really have a severe lockdown or strict lockdown, one village in terms of contribution is not really going to contribute significantly to the business of a company or demand of a company or a particular category. Given that, I feel, companies would be, or demand relatively would be isolated from seeing any dips in rural India due to the onset of, or, due to rural people contracting COVID.
The question though then is that if the population is sparse, it's easy to contain, it's easy to actually trace and catch where the infection is, then Dr. Joshi, let me come to you with this. Why are we seeing this sort of belated rise in cases in rural India? Remember the big fear everyone had when the whole migration first began. I'm talking about, April or so, when people were moving back in large numbers to rural and semi-urban areas back from the large cities, and people were worried that there would be a spread of coronavirus. We have seen sort of a belated action now. Why is it happening? When all the focus was on metros, on big cities, why have cases suddenly started surging in rural areas? Can we really now say that, okay, it's not that bad, we'll figure out where the medical care comes from?
No, I think what you're asking is very relevant and very pertinent. I think you must be careful that there has been a gradual systematic unlocking, and with that has come cross migration. I would agree with Siraj Bhai that people who had migrated to the villages now want to come to the cities, and a lot of people from the cities or smaller towns have gone also to the villages with festivities, festive seasons around, the sowing season around. There has been a lot of cross migration, and when there is transportation and cross migration with a little bit of unlocking, this was anticipated, and I think this is containable. I do buy your point completely that the case fatality rate might be a little on the higher side, and smaller the number, higher the case fatality, larger the number, lower the case fatality. So if you look at India as a whole, obviously our case fatality rate is low. But if you look at some geographies which are localized hotspots, yes, there are some causes of concern. And I think everybody is on the same platform in the health sector that we want to get the case fatality below 1%. We want to make COVID a manageable disease. The biggest challenge in rural India is the stigmatization associated with it. And therefore, the reason of the case fatalities, a lot of people, when they get symptoms, may not go out to the healthcare facilities because they fear stigmatization. And the degree of stigmatization which occurs in urban India may not be same as it would happen in rural India. And therefore, a lot of sensitization may be needed in these areas to destigmatize COVID so that they can take care on time. Appropriate red flags can be there. The vulnerable groups can be appropriately treated so that we can mitigate this so-called higher fatality rate which we are seeing. Also, whenever we see a surge in any small pocket, obviously the mortality initially is high, but after a point of time, there is a plateau and the mortality comes down. And I also agree that even now, we are not out of the woods in many urban metros. We are still going to get, and we have to be very mindful that we don't get a second peak or a third peak. We don't get that surge after flattening the curve after a period of time. So this whole process has to be very gradual and it has to be very correct. And most important thing here is COVID appropriate behavior, which means there is no substitute. The social vaccine, till the real vaccine comes, is still going to be masking, still going to be sanitization, and still going to be distancing.
Dr. Joshi, talking about the social behavior, there is this narrative, I don't know how correct it is or not, that all of these precautions are not being followed as much in rural and semi-urban areas. I mean, there is a public policy that it is against, the law to go out without a mask, etc. But these are not necessarily being followed in these pockets, which is leading to a greater infection rate. Do you think that there is any case for this argument?
That may be partly true, but that is because they didn't see, when the rest of India was seeing COVID, they didn't see so much of COVID. So probably that some degree of complacency is there. But I'm sure the local authorities, and it is for the people at large and the local civic society to rise up to the occasion to have a COVID appropriate behavior or a corona appropriate behavior. And I'm sure that the red signals with the alarming numbers will immediately contain. And I think in any of those red spots, if micro containment is done or containment is done, I think things will go in place. I think that little complacency which set in 4 months, that will go away minute they see larger numbers. And I wish and pray that they are more appropriate in the behavioral pattern, because that's the only way we can conquer corona across the world, not just rural India. This problem has occurred all over the world, whether it's rural Europe, rural United States. The minute there is a laxity on the COVID appropriate behavior, you are going to get mini surges. And these are all very preventable. And I'm certain that Indian population also, if sensitized in the local language, which people understand through local leadership, which is civic leadership, I think we can contain it to a great extent.
Okay. Siraj Hussain, let me come to you on the basic question of rural revival and the sustainability of this rural revival. Mayank Shah a little while earlier said that he doesn't see any big challenge to sustainability of the kind of revival we are seeing. Do you think that the current crop cycle, etc., will help boost this, and indeed rural India will be the driver of revival of growth for the entire country?
Tamanna, I think it is a fallacious argument that rural India can drive the growth story of Indian economy. It can play its part. It is playing its part quite well, actually. But unless the other sectors of economy recover, construction, for example, or manufacturing or services, the income levels in rural area are quite low. And we cannot expect rural to bring a lot of change to the recovery process, because a lot of remittances used to flow to rural areas which have stopped, and a lot of rural people used to work in construction sector, in a small scale industry, in services. So that has not happened. Also, there is another very worrying paradox, and that is that despite the destruction of demand of several commodities, we see a high level of food inflation. So I am also very curious, and I am not able to find an answer why there should be an inflation of some 19% in meat and fish. There is demand destruction. Hotel, restaurant, catering sector is almost closed, and yet meat and fish 19%, eggs about 9%. So pulses about 16%, which means all the protein items have a very high inflation. I think it shows that the urban areas and the supply chain has not really recovered. I do not think it is due to a shortage of these commodities. There is sufficient production. In fact, there is demand destruction, and yet we find high prices.
Mayank, I'd like you to come in on this point. Inflation indeed has been inching upwards. We saw the Reserve Bank also continue with its pause on rate cuts with a concern for inflation. Do you see this impacting commodity prices, your retail prices, or demand in any which way?
Inflation would be there, I believe, and especially in certain categories, especially food and those things, because as we have seen in last few months, the demand has been strong in food items. You've not seen any dip in demand. In fact, because of probably lack of options of spending on many other items, most spends have happened on food. I mean, that probably I have earlier also shared it, on the show, has been the only sort of recreation a part of media. So digital media or, TV was one recreation that, families in lockdown had. The other thing was food. So there has been a disproportionate spend on food. And, going forward, I mean, even as we speak, we are seeing increase in prices of certain raw material. In fact, quite a few, and we've seen, food inflation as a result of that. Going forward, we feel that would continue unless, there's some kind of, glutton probably commodities, food commodities which are available, or government intervention. Government intervention also is playing another role. So, for ensuring better realization to farmers, over last few years, government has, taken up initiative to increase MSPs. So, given all those situations and conditions, there has been, increase in food prices in last 1.5, 2 months. And as I said earlier also that, we have not seen any dip in demand of food items. We feel that, at least till we see the harvest coming in, we will see, the prices inching up a little bit. So that may not have an impact immediately on the prices of finished products, because I think no company would like to right now, given the situation, pass on the increase in prices to consumers. But yes, as I said, that would definitely have an impact on the inflation, that would have some kind of dent in the bottom lines, or probably, some kind of squeeze, I would say, not really dent in bottom lines of the company. So I'm talking specifically about food.
Yes.
So going forward, we feel that unless, government doesn't intervene, we will continue seeing, some kind of inching down above prices of food commodities, and that would have some kind of impact on processed food or finished food items.
Absolutely, and possibly on the kind of revival and growth that we're seeing from rural India. So it is a fine balancing act right now. In conclusion, cases are surging in rural and semi-urban India, more easily manageable because it's not as densely populated, but a lack of medical services, especially for extreme cases or serious cases of COVID-19, remains a huge pressure point, especially at a time when rural India is hopefully leading the revival for the entire economy. I want to thank all of you for joining us on the first big story this evening.